So our people first and patient first goal at the hospital is really about how do we focus every effort with the patient in mind and the associate in mind. Through the whole pandemic, we still pushed forward and worked on some renovations to make our environment a little more aesthetically pleasing. Most exciting is, of course, our postpartum side of our Women's Health and Family Birthing Center.
I felt so catered to, and I think that's something that felt great, especially when you're in a delivery room and you don't know what can go wrong. And then the recovery was just the cherry on top, because these rooms were beautiful.
Yeah.
And I said, this does not look like a hospital room. I feel like I'm walking into like a hotel, at the harbor. I felt like a VIP.
The old postpartum rooms were old semi-private telemetry rooms. So they were never intended originally to be for women delivering babies. So we finally have brought them up to the 21st century, we'll say.
We never knew that we could have that type of experience in a hospital. So for us, we felt so honored, so blessed that we got the first ever room for the new maternity ward.
And some of that funding was in part made possible by one of our past galas, in addition to some other fundraising that we've been doing here.
We needed to share the experience that was truly unique for us about how beautiful a moment can be when, the right tools are set in place and people create that environment, conducive to love and care.
Patients assume we know what we're doing with the quality and the safety side. But the patient experience side is something they can judge very carefully, and it's individualized. I will tell you here and now, though, it matters deeply that patients engage in the dialogue about what matters to them, because we can't read your mind.
I don't know if it was the director or the head of the ward actually came and asked us about what we thought about their new amenities. That was really nice that, one, those amenities were there, but two, it felt like if it wasn't working collectively to make us feel more comfortable, they were willing to change that.
It is about being patient first, and how do you think about all the ways they would want their experience to happen. We can't always meet everybody's needs, but we're trying very hard to make it a better experience, focused very much on trying to make some improvements along the way.
Those little touches, I think, really made a warm difference for us.
We left with a sense of joy, a sense of happiness. We left with a sense of optimism. And I think that the experience that we had here played a big part in that.
Because it starts with your heart and how you feel. People always say you may not remember what they said to you, but you always remember how someone made you feel. And I think that's how this experience was for us. We didn't remember exactly everything the doctor said or every single word that the nurses said, but we certainly remember how they made us feel.
God bless you for remembering the importance of bringing people into this world and saving lives, and the environment that plays into all of that.
Thank you.